Hello, my name is Jeffrey Dunn II, and I'm applying for the brand program at the University of Wyoming, and this is my application video. So we'll start it off with the questions. Question one says, describe a meaningful experience or difficult situation related to a course, an extracurricular activity, or in your personal life. Discuss how this experience exemplifies your ambition and enthusiasm for learning. So when I think of a difficult time I've had with a course, personal life, that kind of one in the same. The semester where I had my most difficult classes, we're talking biochemistry, vertebrate physiology, comparative anatomy. Me and my wife welcomed my first child, Finn, to the world, and I was also trying to juggle a full-time job. Finn did unfortunately have some health problems. He's fine now, thankfully, but um, I kept pushing, passed classes, graduated with my degree in biology from the University of Arkansas at Monticello. Uh, but it was certainly a difficult time, and not for the wary, I guess. But I think it does exemplify my perseverance and my ambition and my willingness to learn, enthusiasm for learning. But yeah, I think that would be the most difficult time that I've had in personal life and professionally and academically as well, all at the same time. Second question states, why is nursing the profession for you? How do your personal values align with professional nursing values? I think nursing is a profession for me because it allows you to establish personal connections and relationships and with patients and families that in my current job in EMS you don't necessarily get to do. It's more of emergency situations, of course, and it's kind of you drop the patient off and that's it. You don't get to forge that personal relationship. And besides the personal relationship aspect, it allows me to expand my knowledge of the human body, the treatments, and I've always been fascinated with the human body, what infects it, what is used to treat it, why it works, the chemistry behind it is all fascinating to me, honestly. Uh, and I think my personal values of empathy and caring, compassion, of course, are all major pillars of the nursing profession, and that's why I believe that I'd be a natural fit for it. Third, the field of nursing consists of working with healthcare team members from a diversity of backgrounds and experiences. Describe a time when you worked as part of a highly diverse team. How did diversity enhance the functioning of that team? So, as an EMT, I've done contract work on the U.S. border between Texas and Mexico, and a highly diverse team that certainly was. And it was imperative to the operating of it. Uh, First of all, at the time, I definitely didn't speak Spanish. I know a little bit now, not near uh, what I should, but I definitely know some now. But it is imperative that, in order to get right patient histories and medications and, you know, any issues that the patient was having, you had to have, the healthcare team working together. The translators being able to translate to you the information that you needed to treat the patient. And then for me to be able to take that to a provider, a nurse practitioner, or a PA, and so that we can ensure the proper treatment for every patient that came across the border at the time. In my current job, I'm working for a staffing agency at Pine Ridge, and of course, being an Indian reservation, it's a completely different culture, but we do have members of our team that are part of the culture and immersing ourselves into it. And it's imperative again that we work together so that we can know the community that we're serving, and so that we can serve them properly and in the right way for their cultural standards. Um, Number four, describe a time when you did not agree with the decision made by a boss, parent, teacher, or coach. How did you approach this, and what was the outcome? Um, I mean, of course, you have disagreements, especially in EMS. You know, you and like me as an EMT and a paramedic or another EMT always have disagreements. You have disagreements with your boss, parents, teachers. That's a given in any field. Any field, you will have disagreements. As far as one that comes to mind, the first one I can think of is we had a regular person that was always highly intoxicated, and he fell. And from hearing the description of you know witnesses and the patient himself, it sounded like a traumatic fall. Well, the person I was working with at the time did not treat it as traumatic as I would assume, and he wanted to just get him up, and I was like, what, I disagree with him. I thought that we should put a seat collar on and follow the proper protocol for that. Um, but as far as how it's handled, I just talked to him calmly. Didn't raise my voice, didn't make a scene about it, and explain my position and my thoughts, and he agreed, and we did that. We got him to the hospital, and he did in fact have a broken neck. So we're glad that we took those steps. But I think the best way to approach it in any situation, whether it be a boss, parent, teacher, coach, coworker, colleague, is to just approach it respectfully. Explain your position thoroughly, in a calm manner. No need. I mean, there's no need to amplify any situation with words or anything. Just explain your position and why you feel that way. And a lot of times, you know, you can come to an agreement. You might not necessarily get your way, but you can come to an agreement that is beneficial for the patient, and that's ultimately what we're all here for. In this field is to benefit the patient. That's what we're here for. All right, number 5. In life, we are faced with situations where we do not feel a strong sense of confidence and we question our own abilities. As a nurse, you will be faced with such situations. Describe a time when you were faced with a situation that challenged your confidence and sense of assurance. My whole first year of EMT, of being an EMT, definitely was faced with many situations that questioned everything about who I am. But as far as for a singular episode, when I was working a basic truck, it was just me and another basic. I was in the back with a patient that coded, and that challenged my confidence for sure, my sense of assurance. But I just you had to get back to the steps. Do this, do this, do this, and that's what I did. And call for ALS intercept. We got that. We were able to get Ross. Unfortunately, it didn't pan out. But at the end of the day, you had to bring yourself back to reality. Yeah, you just got to go through what you know. What you've learned, what you've taught, what you've rehearsed, and even if you've never done it, you've went over every outcome in your mind. And so it's just a matter of putting that into action. And as long as your major thought is doing what's best for the patient, you always come out on top. Anyway, okay, that's all of my questions. Thank you so much for your time and your effort, and I look forward to this opportunity. And go Pokes!